Right, virtual consultations, what are they? How can we use them? What do we do with them? How much information do we get out of them? And do you need to have a regular consultation? Coming right up on Dr. Genevieve. All right, guys, so anybody that's from out of town or maybe even in town that can't really come to our office, we offer virtual consults. A virtual means anything that's done through media. So like we could be on our media program, which is called TouchMD. We send you a link and we can talk. Now, that virtual is only good in as much as you tell us everything about you, including all the drugs you take, the over-the-counters, stuff you take for weight loss, some things that you may not think are important. Tell us everything on that virtual. 95% of the time, I'm gonna send some labs to whatever, to you to get them ahead of time so that there's no surprises. So let's say you do a virtual and you're 2 months away. I'd like to know what your hemoglobin is, your white count, your platelets. Any other medical problem that you have, you gotta disclose that to us. That virtual is only as good as what you disclose. I can't tell you how many times that I've been on this virtual, and I guess you as a group decided not to tell me something. And then we get like the day before, 2 days before, we have to do an official consult with you. And then we're like stuck and we can't really do the surgery. So smoking, drugs, any drugs, medical conditions, even the ones that you think aren't necessary to disclose, just tell us everything. We're gonna find out anyway because we're gonna take your urine, both at 2-week mark, and we're gonna take your urine the morning of. Do not hold back on anything, especially any kind of appetite suppressants like phentermine, Adderall, Vyvanse, marijuana, CBD, drugs like that. Because if you don't tell us, then by the time I'm done with your virtual, I'll think that everything is okay. You're gonna come see us, and then you're postponed. You would have done a plane ticket and all that craziness. So in the virtual, we're gonna ask a lot of questions. I'm gonna look at your body to make sure you're in a place where you could disrobe so that I'll be on, I'll have a chaperone, and this goes for me and all the doctors. And then I'll get to see some of the things and give you some opinions. Now remember, those opinions can change once I see you in person. So again, hit the virtual, you can get a virtual by going up above us and hitting the VIP Express form and say interested in a virtual. You can get on my website, sign up with the forms on the left-hand side of the website, sorry, this side on your end, and you'll just see a contact form, interested in virtual. That way you can get together with us. It's a little bit less expensive too, because I can do a virtual in between patients, or the girls can set it up so that I'm available, or any of the other guys. And that's our virtual concept process. We hope you enjoyed this video, and we'll see you soon.